It's just a pair of slippers. How serious could it really be? Some people wear them for years without any issues, but for others, one small misstep can result in months of rehabilitation or worse. Why does this happen to some, but not to others? What's the real underlying cause? As a physical therapist, I've seen this firsthand. Thomas, a 72-year-old retired teacher, thought his shoes were just fine, until a simple slip on his kitchen floor fractured his hip. His doctor told him, "You may never walk independently again." But here's the surprising part. Thomas made a full recovery, no surgery, no long-term medication through targeted physical therapy and one critical change in his footwear strategy. In this video, you'll discover 8 types of shoes silently harming older adults and 3 evidence-based changes that can help you maintain foot strength, improve balance, and most importantly, preserve your independence. If you've ever experienced foot pain, felt unsteady while walking, or worried about falling, this video is for you. Because just one small change today could protect your freedom for years to come. 1. The hidden danger lurking in your everyday shoes. Let's begin with something most people never talk about: how your feet silently change as you age. The shoes that supported you perfectly at 45? They could be quietly working against you by the time you're 70. And the worst part is, you might not even realize it until it's too late. As physical therapists, we see this pattern again and again. What often feels like just getting older is really a mismatch between aging feet and shoes that haven't changed with them. After age 60, your feet go through 3 critical shifts. First, the soft padding under your heels and toes begins to thin, reducing shock absorption. Second, the nerves that help with balance and coordination become less responsive, making every uneven surface a little more risky. And third, joints grow stiffer, meaning even minor misalignments can trigger pain, wobbling, or even injury. So what does this mean for your daily life? It means that every step taken in the wrong shoes doesn't just feel uncomfortable. It quietly affects your posture, your balance, and your walking pattern. And over time, all of that adds up. Until one day, a small misstep becomes a serious fall. Thomas, the 72-year-old retired teacher we spoke to earlier, learned this the hard way. He told us, "I was still wearing the same slip-ons I'd worn for years. No one ever told me my feet had changed." And sadly, his story isn't rare. Millions of older adults are unknowingly setting themselves up for falls, one step at a time. But here's the good news. This is completely preventable. If any of this feels familiar, stay with us, because next we'll reveal the most common footwear mistakes still hiding in your closet and how to fix them with just a few smart, expert-backed changes. Quick check-in. Have you noticed even a small shift in your balance lately? If so, you're not alone. And now might be the best time to finally listen to what your feet have been trying to tell you. 2. The lingering damage of high heels, even the sensible ones. Let's talk about something that seems obvious: high heels. Most people think, "I don't wear heels anymore, so I'm safe." But even low heels, the so-called sensible ones, just 1 or 2 inches, can cause serious issues. Why? Because even a slight heel shifts your body weight forward. Your toes get compressed, throwing off your center of gravity. Your knees, hips, and lower back all have to compensate. And over time, that disrupts your entire posture. As a physical therapist, I often see postural issues in older adults that began years ago with footwear choices they thought were harmless. It's not always the sky-high stilettos that cause damage. It's the low, reasonable heels worn every day for decades. Janet, Thomas's wife, wore 2-inch heels for years while working as a bank manager. "I thought I was being smart," she said, "but after retiring, my feet started to ache. The little bunions I used to ignore became unbearable." Eventually, she needed surgery, 12 weeks of recovery, right when she and Thomas had planned a dream vacation. Many women still keep a pair of heels for special occasions. And that's the hidden danger, because the damage isn't just from what you're wearing today. It's the accumulated stress from years past that aging feet can no longer support or absorb. So here's a question to get to the heart of it. Do you still have heels in your closet? Even if you only wear them once or twice a year, they may be doing more harm than you think. Be honest. What's the one pair you've kept just in case? Drop it in the comments, and your story might help someone rethink their next step. 3. Flip-flops. Comfortable until they're not. Let's talk about flip-flops. They're light, easy to wear, and often feel like the perfect choice for relaxing at home or heading to the pool. But for aging feet, flip-flops often cause more problems than we realize. Here's what happens. Your toes have to constantly grip the sandals with every step just to keep them from slipping off. This small, repetitive motion creates strain throughout your feet and legs. And because flip-flops offer no arch support or shock absorption, your joints not only absorb more impact with each step, but they also have to work harder just to keep the sandals moving with you. Thomas learned this the hard way on a trip to Florida. I wore flip-flops all day, by the pool, out to lunch, even walking the beach, he said. By day 3, my heels hurt so badly I could barely walk. He was diagnosed with plantar fasciitis, and it took months of gentle rehab to recover. Here's what's important to understand. The shoes that used to feel comfortable may no longer support your feet the way they used to, and that's okay. It simply means your body has different needs now. Here's a quick tip. Try sliding your feet lightly across the floor while wearing your flip-flops. If the shoes don't stay in place, or if your toes are gripping to keep them on, that's a sign you may need more supportive footwear. That doesn't mean you have to give up comfort, but it does mean choosing shoes that fit your feet, not ones that your feet have to chase. Quick poll: have flip-flops ever left you with unexpected foot pain or strain? Type flip in the comments if yes. You might help someone reconsider their go-to summer shoes. 4. Old sneakers, new problems. How worn-out shoes might be costing you more than you think. Let's talk about something most people overlook: worn-out sneakers. On the outside, they might look fine. No holes, still clean. So we keep wearing them, assuming they're still doing their job. But here's what most people don't realize. Even if your shoes look okay, the internal support may be long gone. Sneaker cushioning can wear down by up to 40% after just 6 months of regular use. And once that support is gone, every step you take places extra stress on your knees, hips, and lower back. Thomas ran into this exact issue. He had a pair of sneakers he loved and had worn for almost 3 years, but then he started feeling knee pain. He moved less, became less active, and he never suspected his shoes were the problem. Until one day, someone asked him to try a new pair, just for comparison. The difference? Immediate. His knee pain began easing within 2 weeks. It wasn't that the new shoes were magic. It was the support his body had been missing all along. Here's something you can do right now. Take your everyday walking shoes and gently twist them from heel to toe. If they bend or twist like a towel, that's a sign the structure is gone. A good shoe should only flex at the ball of the foot, not twist through the middle. You don't have to throw them away today, but it's worth checking because the cost of injury is often far higher than a new pair of shoes. Be honest. When was the last time you replaced your favorite sneakers? Type the number of years or months below. Someone else might realize it's time to check theirs too. 5. Backless slippers. Cozy comfort or hidden risk? Now let's talk about something many people still use every day at home: backless slippers. They're soft, easy to slip on, comfortable after a long day. But they also affect your walking pattern in ways most people don't notice. When you wear slippers without a back strap, your toes automatically grip the sole to keep the shoe from slipping off. Over time, that small adjustment shortens your stride and increases tension through your feet and legs. According to some studies, this can even reduce ankle stability by up to 60%, which means when you're walking around the house, opening doors, going upstairs, or carrying groceries, mowing, your body may have less control than you think. Thomas witnessed this with his neighbor, Ruth. She was 78, active, independent, and had worn her favorite backless slippers for years. But one morning, she lost her balance on the stairs. She fell, broke her wrist, and spent months recovering, all because of a small misstep in the hallway. The issue isn't fear, it's awareness and making small changes to protect your independence. Here's a quick test. Try lifting your heels slightly while walking in your house slippers. If the back doesn't stay in place or your toes start to tense up, you may want to switch to closed heel shoes. They can still be soft, still warm, but they should move with your feet, not lag behind them. Let's be real. Are you wearing backless slippers right now? If so, type home in the comments, because your story might be the wake-up call someone else needs today. 6. Slippery soles, silent threat when style turns dangerous. Let's talk about something often hiding in plain sight: slippery soles. We're talking about dress shoes, loafers, or even worn-out walking shoes. They might still look good, they might even feel comfortable, but the soles, that's where the hidden danger lies. Over time, the tread on your shoes wears down. That's a problem, because those patterns are designed to grip the ground. Without them, even a few drops of water on tile or hardwood can turn your home into a slipping hazard. Thomas experienced this just weeks before a major fall. "I was wearing my favorite loafers in the kitchen," he said. "My wife had just wiped the counter, and a few drops landed on the floor. It felt like my feet flew out from under me." That day, he didn't fall, but he did strain his lower back. And that minor incident was a warning sign he nearly ignored. Here's something simple you can do. Put on your everyday shoes. Step onto a smooth surface, like bathroom tile, and gently try to slide forward. If the shoe slips easily, it could be putting you at risk every single day, without you knowing it. Good shoes aren't just about looks, they need traction, because you shouldn't have to worry about slipping on your own floor. Have you ever had a close call at home like Thomas? If so, share it in the comments. That moment might help someone else make a safer choice today. 7. Tight shoes, hidden pressure, when still fits isn't safe. Now let's talk about something many people never question: tight-fitting shoes, especially those dress shoes we've kept for years. Here's the issue. As we age, the shape of our feet naturally changes. Tendons and ligaments stretch. Feet often become wider, even if the length stays the same. But most people still wear the same shoe size they did in their 40s or 50s, sometimes out of habit, sometimes out of pride. The result? Forcing your foot into a shoe that's too tight doesn't just feel uncomfortable. It can reduce blood flow, compress nerves. And for older adults, that can mean numbness, tingling, or even balance issues. Thomas experienced this right before his grandson's wedding. "I hadn't worn dress shoes in years," he said. "They still fit, or so I thought." By the end of the evening, his feet were burning. The nerve compression triggered neuropathy-like symptoms that lasted for weeks, leaving him unsteady at home. He didn't fall, but he lost confidence with every step. Here's a quick test. If your toes cramp or if you take off your shoes and see dark red marks, they may be too tight, even if you can still squeeze them on. Don't wait for pain to speak louder than comfort, because just one day in the wrong shoes can lead to weeks or months of trouble. Still holding on to a pair that feels just a bit too snug? Tell us in the comments what's kept you from letting go. Your reason might resonate with someone else. 8. One pair for everything? Why convenience might cost you more than you think. Let's talk about one of the most common habits among older adults: wearing the same pair of shoes for everything. One pair for walking, for gardening, for running errands, sometimes even for church events or family gatherings. And yes, it feels simple, practical, and cost-effective. But what you may not realize is the hidden cost of making that one pair your everyday go-to. Each activity requires different support. Walking long distances needs shock-absorbing soles and cushioned heels. Gardening calls for ankle stability and side-to-side balance. And slippery surfaces demand traction and grip. Trying to do all of that in one pair of shoes? It's like using the same tool for every job. Eventually, something breaks. And often, it's your body paying the price. Thomas used to do this too. "I had one good pair of sneakers," he said. "They were so comfortable, I wore them everywhere. But over time, they wore down faster, and his knees began to ache every time he knelt in the garden." Why? Because those shoes weren't made for kneeling, twisting, or walking on uneven ground. Here's a simple way to rethink your footwear. You don't need a closet full of shoes, but you do need at least 3 zones. One reliable pair for walking and everyday errands. One safe, stable pair for wearing inside the house. And one task-specific pair for hobbies like gardening or trail walking. The point isn't having more, it's choosing better. And the reward? When you match your shoes to your activity, each pair lasts longer. Your joints stay healthier, and you're less likely to wear the wrong shoes at the wrong time. Do you have a one pair for everything habit? Tell us what you use them for and how your body's been responding. It might be time to rethink the rotation. Solution 1. Get your feet measured. Yes, again. The first recommendation may sound basic, but it's one of the most overlooked foundations of foot health. Have your feet professionally measured and assessed. Research shows that over 80% of adults wear the wrong shoe size, often without realizing it. And as we age, especially past 60, our feet naturally undergo changes. They may become wider, flatter, more sensitive, or experience reduced fat padding. These changes can alter gait and posture. Thomas, a retired teacher, wore the same shoe size for decades, but a visit to a professional footwear fitter changed everything. The specialist measured both of his feet while standing, weight-bearing position, assessing arch height, pressure points, and gait mechanics. The verdict? Your shoes are one size too small. This reassessment transformed his comfort and mobility, because proper fit isn't about the number printed on the insole. It's about how well the shoe supports your biomechanics and movement patterns at your current stage of life. If it's been more than 5 years since your last fitting, or you've never had one, this is your sign. Visit a comfort-focused shoe store or a podiatrist's clinic and request a full foot evaluation. It's usually quick, free, and can help prevent pain, instability, and long-term joint issues. When was your last foot fitting? If it's been a while, comment "measure" below to take the first step toward better foot health. Solution 2. Use a 3-tier shoe system for full-day support. Our second solution is about strategic footwear choices based on activity. Divide your shoes into 3 functional categories to match your daily movement needs. Just as different tools serve different tasks, your feet need different types of support depending on the activity. Here's the breakdown. Category 1. Indoor or in-home shoes. Soft, secure, closed-toe, non-slip soles. Designed for continuous wear on hard surfaces like tile or wood flooring. Promotes balance and reduces fall risk, especially in seniors. Category 2. Daily activity support shoes. Worn for outdoor errands, walking, and light physical activities. Should provide proper arch support, heel stabilization, and cushioning. Must be tailored to your foot type, pronated, neutral, supinated. Category 3. Task-specific or performance shoes. Footwear for gardening, hiking, formal events, or other specific needs, designed to match the demands of the task and reduce compensatory strain on joints and soft tissues. Thomas didn't purchase all 3 at once. He started with the shoes he wore most often, his daily walking pair, then gradually added house slippers and task-specific footwear. He shared, "For the first time, my shoes feel like they're made for me." As a result, his foot strength improved, posture corrected, and he reported greater energy levels during routine activities. This isn't about buying more, it's about choosing smarter and giving your feet the right support at the right time. Which category do you currently lack? Comment your answer below. Your response may inspire others to reevaluate their footwear system too. Solution 3. Custom insoles. Turn everyday shoes into therapeutic tools. The final solution involves optimizing the internal support system of your current shoes through custom orthotic insoles and structural modifications. Finding a shoe that fits perfectly in every dimension is rare. Common issues include: a shoe fits the length but not the width. Arch alignment feels off. Favorite shoes lack sufficient midfoot or heel support. This is where orthotic insoles come in, not the over-the-counter flimsy kind, but insoles that match the contour, pressure distribution, and gait pattern of your foot. The gold standard is custom-molded orthotics prescribed by a podiatrist or physical therapist, but for many, heat-moldable or semi-custom insoles offer excellent value and performance at a fraction of the cost. Thomas used heat-moldable insoles. After warming them and stepping in, his shoes felt like they were tailored for him. He reported improved postural alignment, better balance, and reduced joint stiffness. Other adjustments that can significantly enhance comfort include adding heel cushions to reduce impact force, using shoe stretchers for tight areas, replacing worn or slippery outsoles with high-traction grips. Sometimes the best solution isn't new footwear, it's modifying the shoes you already own to match your current needs, because mobility and confidence begin at the feet. Tried an insole trick that made a difference? Share it below. Your tip might be exactly what someone else has been looking for. Transform every step into a path toward better health. Final clinical reflection. Let's circle back to where we began. 1 pair of slippers. One step forward, one moment that changed everything. Over the past few minutes, you've explored 8 common footwear-related errors that reduce both comfort and stability, and discovered 3 evidence-based strategies that help Thomas regain pain-free mobility and postural confidence. No invasive procedures, no pharmaceuticals, only enhanced awareness, informed decisions, and consistent care for the neuromusculoskeletal system that supports your mobility every day. Your feet are not just extremities. They are your body's base of support, directly affecting gait efficiency, spinal alignment, and overall functional independence. They connect you to your environment, your home, and the people you love. Each step you take sends a message. I still choose to move forward, on my terms. Clinical action steps you can take today. Examine the footwear you use most frequently, e.g., daily walking shoes, indoor slippers. Ask yourself, are these shoes supporting optimal biomechanics or contributing to dysfunction? Make one clinically meaningful change this week. Start with proper fit and foot support. Select footwear that accommodates your individual foot structure, promotes joint alignment, and reduces undue pressure points. Be mindful of your feet. Appreciate them. They've carried the cumulative load of your life, quite literally. They deserve both your care and your gratitude. Because when you support your base of support, you're safeguarding your posture, independence, and long-term musculoskeletal health. Which footwear mistake surprised you the most? We invite you to share your thoughts in the comments. Your insight could empower someone else to take their first, safe, and supported step. And if this video has prompted new awareness, consider sharing it with someone you care about, or subscribing for more clinically backed health guidance. You're always welcome here at Timeless Wisdom Physical Therapy. Stay connected and always step forward, strong, supported, and informed.